For the last 18 months, government and government-adjacent health organizations have aggressively asserted a series of ever-changing and often conflicting guidelines about how Americans ought to behave under the threat of COVID-19 pandemic.
I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low. There's no reason to be walking around with a mask. Wearing a mask might make people feel a little bit better, and it might even block a droplet.
CDC recommends, and the task force recommends, wearing cloth face coverings in public settings.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
That people, even who are fully vaccinated, wear masks in public settings indoors.
We've been told again and again that these guidelines are based on the most current science and that they are designed to keep us safe, or at least as safe as possible under the circumstances. Consequently, those who have questioned the wisdom of the guidance or dares to publicly disagree with the CDC, the WHO, or Dr. Anthony Fauci has been labeled as ignorant, misinformed, and even dangerous. Throughout all of this, public health officials have remained mysteriously silent on topics like preventative steps you can take to boost your immune system and reduce your risk factors for COVID, as well as the topics of natural immunity from the disease, which have unaccountably become a taboo topic. The focus of the media, the government, and the healthcare establishment remains exclusively on vaccines and face masks, ignoring both prevention and treatment options that have the potential to save countless lives both in America and around the world. If the goal of COVID policy is really to promote safety, why wouldn't we address every possible solution? If the goal is immunity, why are we ignoring natural immunity? When asked about natural immunity on CNN, Fauci didn't have an answer.
You know, that's a really good point, Sanjay. I don't have a really firm answer for you on that.
And only questioned the durability of natural immunity, which has been the government line all along. Natural immunity offers unreliable protection. The problem is, this hypothesis is quickly being debunked by science. There have been 81 studies showing natural immunity offers equal or better protection than vaccinated immunity. A 700,000 person study from Israel showed those who had previous infection were 27 times less likely to be reinfected compared to those with the Pfizer shots. This echoed a Cleveland Clinic study's findings that found that none of the group of healthcare employees who had been previously infected got reinfected over a 6-month period. Another study out of Israel showed that antibody levels in vaccinated individuals decreased significantly faster than those previously infected. Experts have found the reason for this increased level of immunity is that the body develops antibodies to the entire surface of the virus, not just the spike protein. And yet, the naturally immune are still being treated as unvaccinated. We should reframe the dialogue from vaccinated and unvaccinated to immune and non-immune, and more emphasis should be placed on antibody tests. But that would be logical, and none of this has been logical. The one-size-fits-all guidelines coming down from government officials begins to look more and more like safety theater every day. While Dr. Fauci continues to be non-committal on the question of natural immunity to the virus, he has very strong opinions about everything else, even when those opinions turn out to be less than honest. In March of 2020, Fauci advised against the use of face masks to guard against COVID.
It's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
A few months later, he reversed himself and argued in favor of mask wearing.
When you're out and you can't maintain that 6-foot distance, to wear some sort of facial covering.
The CDC also didn't about-face on mask wearing. When we actually look at the studies on mask wearing, the best studies suggest they don't work. The CDC has relied on observational studies for its guidance, primarily a study in Missouri that focused on 2 COVID-19 positive hairstylists who were showing symptoms but wore masks while serving 139 customers. None of the customers tested positive. The problem was there was no control. There was no non-mask wearing group, so there's nothing to compare it to. The CDC has ignored all of the controlled trials, however, specifically a 2020 study in Denmark, with 4,800 participants which specifically tested masks against COVID-19. The researchers found no statistical significance between the masked group and the control group. So why isn't the CDC referencing the 14 randomized controlled trials on masks that show no statistical difference between mask wearing and not? Probably because it doesn't fit their narrative. Masks are a symbol of the control that governments have been exerting on their people throughout the past year and a half. A piece of cloth that does nothing for your or anyone else's health or safety besides virtue signaling to everyone else how subservient you are to government dictates. Preventative health measures have also been ignored or outright discouraged. According to the CDC, 78% of patients hospitalized with COVID-19 in the US are overweight or obese. And yet there's not been one statement from the CDC, Fauci, or any other public health expert advocating cleaning up your diet, exercising, or supplementing with vitamin D, zinc, quercetin, or any of the many other supplements that have been proven to help build up your immune system to fight the virus. Even worse than this, the CDC hasn't advocated any early treatment protocols whatsoever. Once you contract the virus, the guidance has been to go home and wait and only go to the hospital once you're having trouble breathing. Well, at that point, it's too late to treat. The government media complex has actively fought against or demonized any alternative early intervention treatments, including ivermectin, hydroxychloroquine, and ignored the efficacy of monoclonal antibodies until it couldn't be ignored anymore. Why would we wait until people are dying to treat them? We don't do this in any other area of medicine. Why would we censor all alternative treatments? Could it be to push the narrative that there is only one viable treatment, and that is the vaccine? The narrative continues to be, just get vaccinated and stop asking questions. This is especially odd given that we now know that the vaccine doesn't stop people from catching or spreading the virus, although it does lessen the severity of symptoms. With new variants on the rise that may render the vaccine less effective, it's more important than ever that we explore alternative solutions to the pandemic. But that's not what those in power want you to hear. They want everyone to believe that vaccines, and only vaccines, will get us out of this pandemic. And that in order to protect yourself and your neighbor, you must line up to get the vaccine and a booster every 6 months, otherwise you're being a bad citizen. Even if we put aside all these concerns and do exactly as we're told, it doesn't seem to do much good. There's little discernible difference in case and death rates between states like California and Florida, which pursued wildly different approaches to lockdowns and vaccine mandates. Nor do we see much difference in those rates between countries that have heavily locked down and those that never did at all. At the start of the pandemic, we were told that failure to lock down would be disastrous. But 18 months later, even the most draconian policies have made no progress towards slowing the spread of the disease. And those who have complied with government mandates in the hopes of getting their lives back have been disappointed as well. As citizens in places like New York and Washington, D.C. continue to require masks and social distancing even for the fully vaccinated, despite the complete lack of evidence that any of this is doing anything at all. I also want to make the caveat that people will generally gladly follow health guidance if it makes sense, has a purpose, and gets us closer to a goal. But a public health bureaucracy that clings stubbornly to its old guidance despite new emerging scientific data is not one that we want to trust or listen to. Dr. Fauci and the CDC would do well to have some humility and admit past mistakes and evolve with the science, but they're not going to do that. Because at this point, it's clear that COVID policy is less about safety and more about control. Politicians and bureaucrats have discovered that a frightened public will do pretty much anything for the illusion of safety, and that this willingness to comply can be used to advance just about any policy agenda they want, whether it's a move towards an electronic health pass, a social credit system, universal basic income, higher spending levels, or a surveillance state in which your personal medical records not only become public, but can be leveraged in denying you access to goods, services, and even employment. Ronald Reagan once said the most dangerous words in the English language are, "I'm from the government and I'm here to help." And according to H.L. Mencken, the urge to save humanity is almost always a false face for the urge to rule it. This is not the first time that politicians have disguised the urge to control as generosity and altruism. We've had a year and a half of pandemic policies that have made no empirical impact on your safety, yet which have separated us from our loved ones, cost us our jobs, created shortages, robbed us of our privacy, stripped us of our liberties, and plunged millions around the world into extreme poverty and suffering. There's no other conclusion we can come to than that our leaders' COVID policy has always been about submission, not safety.